Hey guys.
Long overdue update. It's been 10 weeks
Yeah,
since surgery.
and we just kind of want to give you guys an update on everything. We filmed the video before surgery about kind of the process of everything that happened, from the symptoms and everything else, and the video is going to be right here. Click on it if you have not watched it before you watch this, but we're going to kind of tell you kind of where we are now with everything. And I think the best thing to do is to let Jennifer start from the surgery and on, and kind of what happened right after the surgery, and then we'll go on from there.
Okay, so the surgery was going to be an awake craniotomy. Due to where his brain tumor is, the best way to approach it safely is to do an awake craniotomy so that Matt can be talking to the surgeon the entire time. The problem was that we didn't see coming was that Matt had a seizure during the surgery. So the surgeon removed the part of the tumor that lit up with contrast, which if you watch our first video, you know that's the bad part. But that was a very small part of the tumor. There was a bigger part of the tumor that didn't light up with contrast that he wanted to remove as well. And he was pretty confident that he could remove 70 to 80% of the tumor, the whole tumor, the part that lit up and the bigger part. But he removed the whole part that lit up, but when he tried to get into the part that didn't light up, that's when Matt had the seizure and they had to stop. It left him not being able to speak. The original plan was the surgeon wanted to wait till Matt's speech returned and do another surgery. I personally did not feel comfortable doing another surgery. So when I asked him, can we wait for the path results to come back? And if it's a good tumor, can we revisit the idea of surgery? And at that point, Matt was released from the hospital after 4 days.
Yeah.
And not because he wanted to keep him in there until he could do surgery again, but Matt's speech was not returning in 48 hours like he thought. So, but Matt was walking laps.
Physically, I was pretty good, and now just hearing other people and Jennifer knowing all the things about medicine, it was all the steroids and things like that I was on, but I was able to get up and walk around. We walked around the entire hospital for 2 or 3 days. I have an Apple Watch. I had it on, and I was meeting my steps every day there. And the speech was getting better every day, and Jennifer was there a lot, and we had a couple other people come, and they would walk with me, and, and we could have a conversation, but not a normal one. And then they finally let me go because I seemed fine. Physically, I was fine. Yeah.
And it was just kind of a waiting game for his speech to return.
Correct. And I think part of the reason that the surgeon did not want to wait on the path results is because it was going to be about 2 weeks because they were getting DNA results back. But anyways, I got home and I actually felt okay. I couldn't talk very well, but and it was a little up and down. But the first week, for sure, I felt okay.
Yeah.
And Jennifer was in the shop, and she was working every day, and I would come out and do a little bit of help here and there. And I believe it was sometime during the second week, I hit a wall, and I couldn't even hardly get off the couch.
So we were tapering off the steroids. So that first week, when he was in the hospital, he was on a steroid 4 times a day. That first week, he was on a steroid 3 times a day. When he started hitting the wall is when he started going to twice a day.
Yep. And then during the second week, we went back and saw the surgeon, and he checked us out, and he had the results back of the tumor, and this is where things kind of changed a little bit. So
it was great. It was a really good news. So the path results came back that it was an oligodendroglioma. So there's the oligodendroglioma, there's an astrocytoma, and a glioblastoma. Oligodendroglioma is like a good one. It's not as likely to return, but the problem was that since it lit up with contrast, it's considered a grade 3. So the treatment for a grade 3 oligodendroglioma is chemo and radiation. So now there are, he was saying, I don't think we need to do surgery because this is an oligodendroglioma. It's not likely to come back. It doesn't need to be surgically removed. If it was like an astrocytoma or a glioblastoma, it would be worth the risk to go back in and surgically remove. But since it's an oligodendroglioma, we decided to go, he's like, I think we're done with him as the surgeon, and he referred us to our oncologist who we love.
Yeah.
He's amazing. And so he met with us and explained it a little bit more in depth and explained our treatment process. And that's where we discovered that there's 2 different types of radiation, which our friend who had gone through this, the second type of radiation wasn't available in Alabama yet.
Because it was about 3 years ago he went through
Right.
his stuff. And so we were told that the old, or
Yeah,
well,
so there's
go ahead.
the regular radiation, which is photon radiation, which has been proven successful of getting the tumor to shrink, but it also gets healthy tissue surrounding that area, which causes a lot of side effects. But now they have proton radiation, which is the same thing except with photon, like regular radiation has photons, proton radiation has protons, which are a lot more exact in getting to the tumor, so it spares a lot of healthy brain
Healthy
tissue.
cells. Yeah, healthy cells.
Yes. And so it's supposed to be a lot less side effects. But the problem is that, insurance is usually a battle on covering it. And so now what we've been dealing with is we had been going through that process and insurance denying it.
The doctor, we didn't really do much, but the doctor had appealed it several times to them, and as of today, we don't think that Blue Cross insurance.
Well, we don't know
Yeah,
for sure, but
yeah.
we
We don't know for sure, but we think so far they have denied it. However,
UAB is, we have a grant, so it's going to be 100%
Yeah.
covered, which we can only give to God.
yeah, 100%.
100% is praise to God.
Yeah, somebody that works there had called us a few weeks ago and was talking about it, and she kind of started the work on trying to get the grant, and she ended up doing the whole thing for us and getting it 100%. So we're going to be starting hopefully next week.
Yeah, I think the earliest they said that they had was May 12th. We're still waiting to hear.
Yeah, we're still waiting to hear the start date, but we know that it's going to be 100% covered. So, and this is the way that they've all set this up, is this is not something that we need to be so quickly set up on, that we can take our time with this. So, on starting radiation, so that's what we're going to do. We're going to wait and get into this proton radiation program and see where it goes from there.
So the plan is that he will have 6 weeks of radiation Monday through Friday. The actual part itself lasts about 20 minutes.
Mm-hmm.
So it's going to be 30 treatments. We take a month off.
Mm-hmm. It's every day. So, Monday through Friday on the 6 weeks. So it'll be every day,
30 treatments.
30 treatments, and then
we're going to take a month off.
Month off after the 6 weeks.
And then start, we have an MRI, and we're going to start chemo, and that will be 5 days on oral chemo, and then 23 days off, and then having an MRI every other cycle for 12 cycles.
Yeah, so it'll be just about 12 months of chemo. So it'll be a month and a half of radiation, a month off, and then just about 12 months of chemo. Yeah. So that's where we're going to be, and it'll be some up and down. I think feels for me on how healthy I feel. It kind of like it has been already now, just kind of coming off some medicine and this and that. I think the radiation will go up and down a little bit. This proton thing is supposedly not to have the side effects, but we'll see. And the chemo, the same way. We don't really know what exactly the side effects will be with that, but there'll be something, probably some nausea and probably some tiredness and stuff like that, but we'll just have to go on from there.
One thing that, on our last video, we said prayer requests. Now I'd like to do that again.
Yes.
I was reading Luke 18, verses 1 through 8, and it's called the Parable of the Persistent Widow. And it just really moved in me. And I was like, you know what? I am going to pray specifically and persistently for radiation alone to heal Matt, and for it to be like a huge testimony, and for God to show his power through radiation alone and spare him chemo. And I'm not going to be upset or anything if it doesn't work out that way, but I'm just going, why not? I'm going to pray specifically and persistently for that. And because I have faith, I know God can do this. So why not pray for that?
That's
so
right.
I'd like you to join me in praying for that.
Yes, please. And if you have any questions about anything, leave a comment. We'll be happy to answer, and to the best we can.
If you're going through this and want to know more about it, you can message us
Yeah.
directly, and we'll be happy to share
For
what
sure.
we know.
Thank you.
Thank you.
Bye.